Hi, I'm Charlie Coyle, and today's tricks of the trade are we're going to be reviewing the King Airway size 0 and size 1. It's a new piece of equipment we'll be putting on the trucks at Palm Beach County Fire Rescue for our pediatric cardiac arrest cases as well as our pediatric respiratory distress cases. I'm going to go ahead and open the bags, and I'm going to show you exactly what's in this bag and teach you how to use it to make sure that you use it appropriately. So we're going to start with the size 0. Size 0, as you can see, is going to be for under 5 kilograms. One of the problems with this piece of equipment is the current hand-heavy book that we have out on the rescue and engine trucks does not go down below a size 2. So you're going to have to utilize the application, and that's already had the modification built into the application to tell you when to utilize this piece of equipment on which age patient. So we'll review that by the end of the segment. So I'm going to open up the bag for the size 0, and as you can see, it also has a different inline filter. And the purpose of this inline filter is it has a collapsible spring. And the collapsible spring is to prevent the dead space from the regular inline filter, making sure that it pulls a good sample up and you're able to get an accurate and tidal CO2 reading. So when you get this bag on your rescue truck or engine at size 0, it's going to have a specific inline filter that you should be utilizing when using this piece of equipment. Some other considerations and things to take into thoughts to ponder when opening this piece of equipment. This is your size 0 tube. And as you're going to see that there is no inflation rate on the tube itself. You've got to look at that at the individual package. And I'm going to utilize the size 1 just to show you exactly what I'm talking about. This is going to be your inflation ratio or your inflation volume. So as you can see, 20 mLs. For the size 0, it's going to be 10 mLs of air. Okay? It's going to come with a 25 cc syringe. So you want to make sure that you only inflate this to 10 cc's of air. Okay, because what we found out, the studies have shown the excess air that's in the inflation cuff pushes outward on the carotid arteries, decreasing carotid blood flow to the brain due to overinflation. So you want to make sure that you utilize this in the proper form and fashion. So the app is going to tell you what size King Airway as well as the inflation rate. Some other things that you're going to find in the size 0 bag is the saline sump gastric tube. So the size 0 and the size 1 King Airways have a little gastric access port in the back of the tube. So when you insert the gastric tube, it's going to come out and it's going to go right into the stomach. This is a part of the size 4 King Airway. It's part of the 3 King Airway. It's part of the 5 King Airway. The only 2 King Airways that we currently have in stock that doesn't have the gastric access port is the size 2.5 as well as the size 2. Now they do make these 2 King Airways with the gastric access port, and through attrition, after we get rid of this stock, we're going to be receiving the 2 and 2.5 with the gastric access port. So that's the size 0. The size 1 is the same thing. The same contents come in the bag with the exception of the actual neonate inline filter. Now I'm going to demonstrate the installation of the King Airway size 1 for a 4-month-old child. So the first thing I would do on the way to the call, as soon as I heard the call come across from dispatch that we were going to a 4-month-old cardiac arrest, was look at my Antevi app and figure out what size is the appropriate King Airway. So by doing this, I would look at the 4-month-old, I would scroll down to the bottom, and I would look and it says size 1, 20 mLs of air. So when we got on scene, I would give my 2 big breaths and make sure that I ventilate the child, make sure the breaths go in. The breaths go in, and now I'm going to be prepared to go ahead and insert my King Airway. Opening the package, in case you didn't see it on the app, again, the only way to determine how many mLs of air have to be inserted into the tube, it's going to be on the outside of the package. So I look, I have a size 1, and I'm going to be inflating 20 mLs of air. Go ahead and get my syringe ready with 20 mLs of air. Okay, now I'm going to show the insertion of the King Airway. You're going to make sure the child's head is in the actual neutral position. After that, you're going to go ahead and lubricate the distal end of your tube, and you're going to go ahead and perform a little bit of a modified jaw thrust where you're going to pull the child's jaw down. As you do that, you're going to insert the King Airway until you can go no further. You're actually trying to get the gastric access lumen, the back part where you insert the gastric tube, all the way down to the teeth. After you do that, you're going to rotate it back to midline like I did, and then you're going to inflate it to the desired amount. The next portion is we're going to use our inline filter, tidal CO2 inline filter. So now we're going to go ahead and use our BVM, And this is a very important part of the King Airway. So if you go to ventilate it and you meet resistance, much like we're meeting here, it's because you need to pull back. The actual tube is too far into the esophagus and the ventilation hole is occluded. So you're going to pull back while ventilating until you get adequate chest rise and fall. After you get adequate chest rise and fall, you're going to go ahead and listen to your epigastric sounds, listen to your lung sounds, much like an endotracheal intubation, and watch your tidal CO2. After that procedure is done, you could go ahead and insert your gastric access tube. Now, if this is a cardiac arrest patient, whether it's 4 months, whether it's 4 years old, 6 years old, any child that's in cardiac arrest, it's going to be 1 breath every 6 seconds. If they're greater than the age of 1, you're going to be utilizing the rescue pod as well. So I would hand this off to my partner who's going to give the 1 breath every 6 seconds, and I'm going to walk you through the gastric tube insertion. So the gastric tube insertion, it comes in the package like we stated earlier. We're going to go ahead and measure this. It depends on which textbook you read. There's multiple different ways of measuring it. I'm just going to show you the standard way. You're going to go from the patient's mouth to the patient's ear, and then you're going to go ahead and measure down to the xiphoid process. After you do that, you're going to find the line, or you're going to mark exactly where you want the gastric tube to go down, the appropriate depth. So after we've lubricated the King Airway as well as the gastric tube, we have it to our desired depth that we want to insert it down the King Airway. You're going to go ahead and just feed it down the back gastric access lumen until it gets to the appropriate depth. After it gets to the appropriate depth, you could just put a little piece of tape on the King Airway to secure it. At this time, you could also use the endolock or a piece of tape to secure the actual tube to make sure that it doesn't move during transport. The next part of this is the running end of the gastric tube. The blue is always going to be left open. You're never going to seal the blue off. We're not going to perform this. That's not what this is meant for. If you hang it down lower than the actual stretcher itself, you might drain some gastric content out of the baby's belly. So if it begins to drain and it starts going all over the back of the truck, real simple, pick it up, let gravity take its course. The belly will still be venting and the gastric content will be going back down into the stomach. Or you could just go ahead and stick it into the trash can in the back of the rescue truck. If you're going to perform suction, I will tell you that you need to perform it only for a few seconds. And there's a couple of steps that I'm going to show you that can make it easy to perform the suctioning. So this portion is designed to go on the end, the running end as well, of the actual suction tubing. After you've made this connection, again, leaving the blue end open, you can now perform suctioning of the baby's stomach. However, this is something that's going to be done just for a short period of time, and that's to remove some of the air in the stomach. Before you turn on the suction device to suction some of the air out of the belly, you want to make sure that you pull out your low pressure switch. This is designed to give a reduced volume of pressure while performing suction to the belly. There's a very big difference. Without that low pressure switch pulled out, this device can deliver up to 525 millimeters of mercury of pressure. With it pulled out, it delivers roughly 125 millimeters of mercury of pressure. That can make a drastic difference. When they do it in the hospital, it's at a very low setting, 10 to 30 millimeters of mercury of pressure. So please make sure that you pull the low pressure switch on, and only quick, just to drain the belly or pull the gastric content out. This should be very short, and this could be done throughout the call. Again, we will be ventilating the child 1 breath every 6 seconds. And we will make sure that we have our device secured somehow, watching for adequate chest rise and fall.